So good morning, everybody. Welcome to the April meeting of the CQC board. We have no apologies for absence. We're all here. I particularly want to welcome this morning Beth Matthews from our LGBT Equality Network. Beth, you're very welcome, and please put your hand up if you wish to speak at any time during the meeting. Declarations of interest. Is there anything anybody needs to declare? No, that's good. Thank you very much indeed. That takes us, I think, to the minutes of our March meeting. Are they a true and accurate record of everything we discussed? Lots of nods, so we will take those as approved. There's nothing outstanding in the action log. Is there anything else arising that anybody wanted to raise that doesn't come up on the agenda later? Great, good. So let's move straight on then to the executive team report. Ian, to you.
Thanks, Peter. Just a couple of quick things from me this morning before handing on to colleagues. I'm pleased to say that the consultation that we've been running on taking a more flexible approach to regulation has now closed. We're just analysing the responses to that consultation. Board members will recall that consultation was run to give us more flexibility around this link between inspection and ratings and one or two other things that we knew had slightly held us back in terms of thinking innovatively around our future regulatory approach. So we'll obviously analyse the consultation responses, but it's an important building block towards being the smarter regulator that we aspire to within our strategy. So of course, as you know, we're bringing the strategy to board for consideration in the next month or so. So with a view that the strategy will launch on the 27th of May. So this is just an important underpinning component part of it. So the second thing I wanted just to touch on is I gave evidence to a Public Accounts Committee inquiry yesterday, on Monday, I should say, on the adult social care market in England. I was with colleagues from the Department of Health and Social Care, the Ministry of Housing, Communities and Local Government, and I gave evidence, particularly evidence that's been sourced from our market oversight team that had contributed to a National Audit Office report, particularly around the financing of the adult social care market. So that was, I think, an important opportunity for us to give our point of view on the role that we play and indeed don't play in some cases in relation to financial regulation of the adult social care market. So Peter, that's all I really wanted to say before handing off to Kate. Great, Kate, over to you.
Thank you, Ian. So just to update board on infection prevention control efforts in adult social care. Since this paper was published, I'm really pleased to say that there have now been over 6,600 inspections since April last year. And as board are aware, this is a blend of responding to risk, so risk-based inspections, and also our inspections looking at infection prevention control against the 8 ticks of assurance. On the risk-based inspections, so those are inspections where we've gone out to see services where we've had concerns. 54% of those inspections are being triggered by information we continue to receive from the public, from people who use services, from family members, and from people who work in social care. So just a plea to continue to ask the public to let us know about good, bad and mixed experiences of care, because it absolutely drives our regulatory understanding of risk and quality, but also our efforts as to where we should go out and cross the threshold. So 54% of our risk-based inspections are driven by information we get from members of the public. So a big thank you to colleagues people in the public who take the time to give us that information. We do use it. And I'd also like to say a big thank you to all of our inspectors who are involved in undertaking these huge efforts to get out and get these numbers of inspections underway. Just want to focus on one particular issue with regard to our inspections, and that's the issue about visiting in care homes. So throughout the pandemic, we've been really clear that we expect care home providers to follow government guidelines, to pay attention to their local risk levels, so advice from their directors of public health, but that we've always expected an individualised approach to making visiting happen where it's safe to do so. So we've always looked at it as part of our IPC, is visiting happening in a safe way. Following changes in recent guidance, we've now got a new mandatory question within our IPC tool to provide evidence about how that care home is enabling visiting to happen according to current guidance. And we are also, through various different communication channels, really asking people whose loved ones are in care homes to let us know if there are any issues with having visiting happen. So we've been really clear that there should be no blanket bans on visiting, that people should be able to see their loved ones, noting that care homes still have the really tricky balance of ensuring that happens in a safe way. So visiting might feel very different at the moment with certain time slots and people being visited maybe not in their usual in the usual way, but we absolutely do not expect to see any blanket visiting bans. And where potential visiting bans, blanket approaches have been brought to our attention, we have followed up on every single one of them, and we haven't found one to date. So that's a bit about IPC, and then if I can briefly update board on the ongoing work around closed cultures. So as our board is well aware, it's a real priority for us about how we effectively identify services at risk of developing closed cultures and how we can enhance how we regulate those services. So we've developed guidance, we've recently done a survey to ensure that our staff have a good understanding of the issues around closed cultures. What that's teased out is there's still some work we need to do around inspectors' confidence levels, about having the variety of communication skills they might need when hearing directly from people who access such services. And also we're underway now with these with inspections of services for people with learning disabilities and autistic people, where our inspections are placing an increasing emphasis on observation, of sitting and observing and just immersing themselves in the service, in the care that's being delivered, to help inform richer reports that really give people who are looking at the quality of that care, and commissioners, for example, a good flavour of what it feels like to receive care in that place. That's it for me. Thanks, Peter.
Thanks. Does anybody want to come in on any of that? Man, two very important matters there. No? Okay. Oh, yes. Yes, Robert.
Thank you. Thank you for that, Kate. So just on the visiting care homes, something's come to my attention recently, and I hope I've misread it, but I'm not sure I have. Is it about the ability of people in care homes to leave them, as in go out, either on a visit or whatever? That if I read the guidance correctly, this is permitted, but when they return, they have to isolate for 14 days. And I'm wondering why that is, if that is the case, why that is so different from the requirements of other people going out. And also what CQC does about it. That's perhaps the relevant point.
So a really important issue, Robert. So new guidance published maybe a little over a week ago. You are correct in your interpretation of that government guidance. Your reflections on it have been echoed quite strongly by many of the stakeholders who talk to us. So we have been very much a conduit of that, those concerns and that reaction back to the department, and we will continue to share that information with the department and flag what the impact of this may be in terms of kind of quality of life for people in those settings with care homes, following that latest guidance.
Am I right in thinking it doesn't matter whether or not the resident has been vaccinated, because most of them, of course, have happily now been vaccinated, and I appreciate that's not a complete fail-safe, but it does seem to me an area where elder people's rights in care homes are being treated entirely differently to the rest of the community.
So, as I say, the guidance very recently published. There's been a strong reaction to a whole wealth of people, and we are ensuring that the government is aware of that strength of feeling and what it means in terms of practical terms of the sector trying to implement that. And at the heart of this visiting has always been this balance of keeping people physically safe while enabling them to have a quality of life and loneliness issues and visiting and seeing families, etc. So we will continue to give that feedback to government so that they are aware of the impact of that.
Thank you.
Thanks, Kate. Right, Ted, I think we'll move on to you, isn't that right?
Thank you, Peter. board members may remember that last autumn we published a report, a very important report, on how mental health, the needs of patients with mental health needs were met in acute hospitals. Excuse me. That was based on 100 inspections and demonstrated the importance of looking at people's mental health as well as their physical health when they're admitted to acute hospitals. And looking after people effectively in acute hospitals required the hospital trust itself to make sure it was focused on their needs, but also needed support from local mental health services. Currently, we're focusing on an area of particular concern at some recent inspections where we've seen children and young people admitted to acute wards in hospitals and not receiving the care they require. Either the environment is not as it ought to be, or the staff do not have the training and competencies to look after these children and young people well. Now, where we find it, we are taking enforcement action to make sure that action is taken to protect these young people's well-being. But having said that, I think it is really important that acute trusts have clear guidance on how they manage children who are admitted with mental health needs. And I'm glad to say that NHS England has agreed to issue some new guidance on this to acute trusts, and we're looking forward to that coming out shortly. We're also continuing our maternity inspections, risk-based maternity inspections, looking at maternity services. The board will be aware that we've raised concerns about the culture within some maternity services. This original issue was brought to light in the Morecambe Bay report several years ago and was reiterated in the Ockenden report last autumn. So it remains a very real issue, and we're finding cultural issues in maternity services as we inspect them. We're reporting on individual maternity services and taking action, of course. But again, I'm glad to say that NHS England is taking the issue forward. They have called a national summit of national stakeholders next month to review what can be done together across the board to address this underlying cultural issue and to improve the safety of maternity services going forward. So I think that's a very, very important initiative, which I'm pleased to see. We're continuing to use the transitional monitoring approach to look at independent healthcare. We've now completed a programme of looking at all our independent healthcare providers, and where that approach has identified risks, of course, we're following up with inspection. But having said that, we are now reviewing how effective the transitional monitoring approach has been to establish, giving us assurance about the safety and quality of care across independent healthcare. And I think that's going to be a very valuable exercise, both for us assessing independent healthcare, but also for the CQC in assessing how the app works. We're using a similar approach on vaccine centres, and we've now followed up with using a transitional monitoring approach in vaccine centres across the country over the last few weeks, and we're keeping abreast of new centres as they're set up. As the rate of nosocomial infection of COVID have diminished, we are now reviewing our approach to infection prevention and control going forward. I think the COVID pandemic has demonstrated how important this is in terms of providing safety in hospitals, and we need to make sure that we've learnt the lessons from that. So we are going to be continuing our approach on infection prevention and control, but focusing on non-COVID areas going forward, and we're presently reviewing our approach to that. We're also starting our programme of inspections of trusts where we have concerns or where the trust has an inadequate or requires improvement rating, or whether the trust is in special measures. We are now planning to go back to those trusts over the next few months, and that programme of inspections has started this week with unannounced inspections of some core services. They'll be followed up by well-led inspections to assess the trust overall using our current methodology, but in a streamlined format to make sure we reduce the burden on trusts that are already under a lot of pressure following the COVID pandemic. But we do need to go back and see the trusts where we have concerns, and I'm particularly concerned that we are in a position to make recommendations about special measures for those few trusts that are still in special measures, and I hopefully will be able to move forward with that in the near future. That's all I wanted to say, Peter, about the current picture. Happy to take any questions.
Thanks, Ted. The culture in maternity services, I mean, it's a massive issue. As you said, it's been around for a very, very long time, and I know you're doing a huge amount and working with partners as well. I mean, do you think realistically this time we can really see this cracked? So,
Peter, we have to, if we are going to turn the corner in maternity services. But it's, I mean, the culture in maternity services is a particular concern, but it is to some extent a microcosm of the wider safety culture issues that we've identified in our strategy. And I really take the view that if we're going to apply our strategy of safety through learning, maternity is the right place to start. We can make the biggest difference most quickly there. But having said that, I think what we learn in driving this forward in maternity, we can then apply it in other parts of the system, because getting the safety culture right across the whole of health and social care, I should say, is really important if we're going to drive improvements in services. So I think this is an opportunity for us to learn how to do this well. There is a real commitment, I think, from other stakeholders, other parts of the system, to work together on this. And I think it is now widely recognised that the issues in maternity are not purely process issues, they are cultural issues. Leadership culture, multidisciplinary working, driving real safety through the system. And I think there's a real opportunity to move this forward. So in answer to your question, I'm determined we should crack this. It's too important not to do so.
Great, because I so agree with you. Right, if nobody else wants to come in, I think, Rosie, we move on to you, please.
Thank you very much, Peter. So 2 areas to cover in my report at this time. The first is about our regulatory approach. We are aware, again, of huge demand in primary care and general practice, particularly at the moment. We know that GPs are working very hard to deliver the vaccination program, as well as significant demands on GPs being reported in terms of increased people attending appointments, and also some of the we're hearing from GPs about some of the impacts of long waiting lists and the backlog of cases that are happening on them. So we're fully aware of the demands in primary care. So we are balancing delivering on our function with those supporting providers with those demands, and we are. With general practice, we are looking at re-inspecting our requires improvement practices, or practices that have regulatory breaches, or looking at following up areas where there is significant risk. With independent health, our focus is more on those practices that haven't been, or those providers that haven't been inspected since registration, and also those ones with a breach of regulations. And our dental inspections are very much following a risk-based approach as well, but looking at how we incorporate the learning and the work that we've done on the TMA approach, which has been very well received in the dental sector. So that's our regulatory approach. Just to mention as well, the provider collaboration review work. We have completed the field work for cancer and learning disabilities, and we shall be publishing the results from those. We are just soon to be undergoing the mental health review work. As the report says, this focuses on children and young people's mental health across the whole pathway. I think we all are concerned about the impact that the pandemic has had on children and young people's mental health, and we feel that it's really important that we look to make sure that people get good access to care and the right care and treatment at every aspect of the pathway, which includes areas such as primary care, community services, and also the very kind of high level mental health need in mental health settings. So that work is due to start in May, and lots of preparation is going ahead with that.
Great. Rosie, I can report that I had my second jab yesterday through my local GP practice. It's the only advantage of being older than anybody else in the room, because I get there quicker than you do. They're just so well organised. It's something we should be very proud of, I think, as a country. Just brilliant.
Absolutely.
Good. Right. So having got that off my chest, let's move on. Kirsty, the vaccination programme more generally, I think.
Thank you, Peter. So, as you say, seamlessly transitioning into the vaccination programme. So We continue to keep a monitoring approach to vaccination. We are making good progress with both the vaccines monitoring in PMS and in hospitals. We are using our transitioning monitoring approach in PMS to do that as part of our risk-based activity. And within hospitals, we have adapted our activity to use our vaccine monitoring app. Again, risk-based approach. So far, we have found no issues to date. We have conducted assurance activity on around 78% of those mass vaccination sites, and found nothing untoward particularly. What we have done is we have adapted our methodology slightly to make sure we are picking up issues around equality and diversity and human rights, around access to vaccines for migrants, and also around language, to make sure that we are just covering those off in our evaluation. So all good. We continue to work with NHSIE and Department of Health and Social Care as a collaborative approach around the vaccines. And as you say, it seems to be a very positive piece of work that is gone on there at a national level. Moving on to the people plan update. In terms of our people plan work, we continue to work across on a number of fronts around our people activity, but just to draw highlights to a couple of areas this month. One, it's Stress Awareness Month for April, and we've been running a healthy working campaign as part of that for our well-being. We are having a session of activities around how to have a good day at work and making sure that people have a good work-life balance where possible. We've also made available to our colleagues the Headspace app to help people with mindfulness tools and things like that. That's gone down very well, with over 1,000 people downloading that in the first month of its availability. We are also continuing to work across our diversity and inclusion agenda, and this month we just wanted to highlight that we have introduced some new roles at directorate level, which are our diversity and inclusion advocates. These are going to work at a directorate level to make sure that we are driving best practice at a delivery level and at a local level, working with the management teams and with colleagues to ensure that we really do embed best practice, and also ensure that we have a good link with our transformation and strategy work in terms of making sure we put diversity and inclusion front and centre of what we do. So that's all from me on those areas this month. Thank you, Peter.
Perfect. Thank you, Kirsty. Does anybody want to come in? Okay, so Ian, sorry.
Peter, can I just picking up the points about diversity and inclusion? I note that the Commission on Race and Ethnic Disparities reported a couple of weeks ago, and I think I would broadly welcome the report in terms of there were a number of very powerful points. I think the only thing that I would say is that the particular recommendation that related to CQC was something that we're talking to the Department of Health and Social Care about, because we have been working with NHS England's RES team for some years now on promoting the RES, and I know Ted will want to come in and just talk about some of that work in a moment, but I think it's a powerful report. I know it had a somewhat mixed reception in some quarters of the media, but I think there are some important points to make, and I think if I look at our work more broadly, it absolutely connects in with our intentions around our new strategy, which has inequalities as at the heart of how we will be going forward. And of course, I think we've got a strong track record of working within inequalities, particularly with the RES team over a number of years. But I know Ted will want to build on that. Thanks.
Ted.
Yes, thank you, Peter. Yes, the workforce race equality standards in the NHS or for NHS services were introduced in 2016. I'm really glad to say that right at the start we recognised the importance of this agenda and built the adherence with those standards into our well-led assessment of NHS services. And I think the fact that we have drawn attention to it in our reports, occasionally taken enforcement action, not directly on the race equality standards because we don't have powers to do that, but using the Health and Social Care Act, where we believe that the culture in organisations identified by the race equality data indicates that it's affecting the quality of care for patients, we have been able to take enforcement actions. In one case, it was a very important part of a reason for putting a trust into special measures, so that we have used these standards going forward. And I have to say, I think the work we've done has been really very important in bringing them to prominence in the NHS and has made a difference. But I think this report that's come out has identified that more work needs to be done, and that is entirely correct. And this is an agenda we're not going to let go of. We're building the race equality standards, learning from what we've done over the last few years into our well-led framework going forward. We're determined to make a real difference to race equality in NHS services, and I think the board, I think this report is right in drawing attention to the inequalities that still exist amongst staff in NHS services across the board, and that is something we're very keen to take forward in our assessment of leadership and culture in NHS trusts going forward.
Thanks, Ted. It's so important, and I'm really pleased to hear what you've just said. Thank you. Anybody else wants to come in which case, shall we move on to the performance report? Chris.
Thanks, Peter. Yeah, so just a quick update. We've got a fuller end-of-year recap of performance and delivery at next month's board session, which hopefully paints a story of the year. So just in terms of the year to February and beyond, so in effective registration service, we process simple applications an average of 20.5 days and complex applications of 114.3 days. Pull out more on that, I'll say, next month. Our performance responding to safeguarding alerts in 1 day or less is 97%, and concerns in 5 days or less is 94%. Both carry a target of 95%. As at 6th of April, just over 54% of inspections that were triggered by risk were a result of information of concern we received. So really demonstrating how safeguarding and whistleblowing information is used as a key piece of intelligence. And also at the same point, 6th of April, 7,006 locations have been inspected during the year. And 24,000 active locations have had either an inspection, an ESF or a TMA call since the start of the year. So that's just over 50% of active locations with some form of regulatory action during the year. Finally, just in terms of how we equip our organisation and people, staff turnover remaining stable at 7.61%, and just over 10% for those with under 2 years service. And on our budget, we're forecast to be 13.2 million underspent on our revenue budget, and 1.8 million underspent on the capital budget. Thank you.
That's all pretty good, I think, Chris. Thank you. Anybody else? Gosh. Oh, yep, Sally.
Thanks, Chris and Peter. Can we just clarify what we might do with the underspend? Is it carryable forward?
Yeah, so I can answer that.
Go on, Chris. Yeah, you
so we'll retain the underspend within our reserves as part of the end of year, and accessing that will be through discussion with the department for future years, but we'll retain those in our reserves.
Thank you. We've clearly got a number of important programmes on, haven't we, that may have been slightly delayed by the pandemic. So I don't think it's an underspend, it's a slight delay. So that's reassuring. Thank you.
Yeah, I think it's really important that with the sort of long-term multi-year programmes that we're running in places, that we can't just look at each year in complete isolation. But obviously also overall we're not a for-profit organisation, so eventually if there are surpluses that we don't need to use, then they get back to fee payers, either in reduced fees or conceivably, I think unlikely, but conceivably in a refund, but not just taking it 1 year at a time. That makes no sense in my view. Right, Mark, you actually, Ian, did you want to come in on that point?
Yes, it was just on that point. I think it's a good point, Sally. I think what we've managed to do over the last couple of years is to freeze our fees And what we're trying to do with providers is give them some long-term certainty. So we're making the investments that we've talked about in previous meetings around new IT infrastructure and so forth. We're trying to do that whilst at the same time keeping fees as stable as possible, so to give providers that long-term stability that I know is so important. So yes, just to reassure you, those that underspends will be recycled back into our work. Thank you.
Thanks, Ian. Mark Chambers.
Thank you. I'm reassured by the information that's in the pack. I should emphasise that before asking this question. But obviously, for some of these metrics, and I'm focusing particularly on the safeguarding one, the tail could hide some quite difficult and bad situations. So it would just be helpful to understand the process a bit for how, and hear a bit more about the process for those metrics where the devil could be in the tail. What is what's the management process behind looking at those at variance across this?
Kirsty, is that one you'd want to comment on initially?
Thanks, Peter. Yeah, I can certainly look at that. So in terms of the metrics, I think there's looking at the sort of the outliers, as you say. So we want to make sure we understand what the sort of our average is, but then also make sure that we're looking at those ones on the edge of the bell curve to make sure that we're not picking things up. Things like safeguarding, where we've got discrepancies, we pick these up at our executive team on a monthly basis. And I know, and I'm sure that the chief inspectors will confirm this, but we go through those at quite a lot of detail to make sure that we're picking them up and making sure everything's got an action against it, so that we are covering those off. We're also making sure that we're learning from things. So if we have got areas where we've got where we're consistently picking up, the tail is not getting down or it's growing, and really trying to understand what's driving that, so that we can get to the root cause and address some of those issues, so that we can make sure that we're tackling them in the right way and not just constantly putting a sticking plaster over the top of it.
Kate.
Just very briefly to bring it to life in terms of kind of operationally, the functionality we've now got in Power BI means that there's a trigger for our inspection managers if a deadline's not been hit, to inform their conversations with inspectors to seek assurance or to help them get past any blocks or delays. And then there's also then an escalation to our heads of inspection if that progress hasn't been made. So there are a number of checks that means that this is getting escalated if action isn't happening. Often it comes down to clicking the right box, or it comes down to I can't close this off till I've been assured that I passed it on to a local authority and they've done with it what they've needed to. But in terms of our Power BI giving us the tools that we need to have those conversations to give us assurance, I think I can speak confidently for my inspection managers and heads of to say that they've absolutely got that tool now.
And Rosie, I don't know if you want just to agree or you want to add something.
Just to build on that, we also have a system where our delivery team contact the relevant IM, having looked at the data on a weekly basis with the information, just to make sure that nothing does slip through the net. So we have got robust systems in place around that.
Great, thanks, Rosie. Thanks, Mark. So I think that enables us to move on to cyber risk security. I'm hoping, Mark, there's another nil report.
Very, very pleased to offer a nil report, Peter.
That's what I like to hear. Thank you very much indeed. Chris Day.
Right, just to give colleagues an update on some of our engagement with government and Parliament recently. Following the Are We Listening publication, we've been asked by the Health and Social Care Committee to give some evidence to the inquiry into children and young people's mental health, which I think is an important vehicle for us to sort of to highlight some of our ongoing concerns about the treatment of young people in mental health settings. We've also submitted some evidence to the Health and Social Care Committee on the government's white paper, and we're continuing conversations both with government and Parliament in that important area. And today we're offering some evidence to the Joint Committee on Human Rights regarding visiting in adult social care settings. More generally, I just wanted to make the point that we continue to give both oral and written evidence. Usually we've got 2 committees preparing at any one time, and we give on average oral or written evidence every 2 weeks to a committee of Parliament, in addition to the informal conversations that are highlighted in the report. I think this is helpful because it ensures that our voice and our ability to drive change and improvement in the system isn't just about media releases, and it is also about the conversations we have with both government and Parliament, so that they understand what we know to help drive change in the system. That was it, Peter.
Great, thank you. Quite a lot going on. Unsurprisingly, quite a lot going on in Parliament. So is there anything else anybody wants to raise in relation to the executive team report? Just then, my thanks to executive colleagues, because there's an awful lot going on, and I think the report barely touched the sides of the activity. So thank you for that. Kirsty, we're running a little ahead of ourselves now, but are we able to do the pulse survey? I don't know if Jill is with us yet.
I think if we can get Jill in, we should be able to pick that up. Don't want to steal her thunder, so.
Certainly not.
Naomi, have you called her in?
I'm just doing it, yeah.
Peter, I was just going to follow up on your comment on vaccinations.
Yes.
That I think everybody who's had one has had a fantastic experience, haven't they? But even if you haven't had both of them, the results are really encouraging, aren't they, in terms of hospital admissions and the prevention for people who've only had one of the vaccination jabs? People on the board are feeling quite confident.
I mean, I just think it's just a triumph of science to have got the vaccinations, and a triumph of delivery for the NHS. Just been superb. So some younger members of the board are still waiting for their first, but that's the price you pay for being young, I'm afraid. By the way, I'd swap to be much younger and not have the vaccination. But anyway,
Chairman, I think it's important to say it's a triumph for the NHS and a lot of volunteer organisations who've helped to deliver it out.
Absolutely right, Mark. Thank you for that. So, Jill, are you now with us?
I am, yes.
Marvellous. I'm sorry we've disrupted your morning by being ahead of time. But anyway, it gave us a chance to have a quick chat. So the pulse survey, please, Jill.
Thank you. Good morning, everyone. I'll give a kind of quick summary of some of what I think are the highlights, and then I'll pause so that we can have a conversation. So it's worth remembering that the purpose of this pulse survey was to test engagement with our D&I strategy, and also to gather data for our next annual RES and WDES reporting cycle. For me, I think there's really much to be pleased about in these results, with some very healthy positive responses and some important positive trends against some historically low scores in the past. We've got a really healthy response rate again in this survey, although probably a little down on what we've had in previous surveys, including our most recent pulse surveys. And I think that was probably down to the timing of the survey itself. We, in the body of the survey, we asked again the really important questions on individual well-being, and the data tells us that generally people are feeling more positive than perhaps they were this time last year or in May when we asked the questions the first time. This data, as you know, is really valuable for local leaders to look at the kind of the sentiment and any hotspots or challenges that their teams might be experiencing. So I think the value of this data comes when we get the aggregated scores further down. The behaviour at work section, again, some great results. The I am treated fairly at work question, 80% positive, up 8 percentage points since the main survey in November 2019. Plus, there's a 10 percentage point increase for the questions about our commitment to an environment free of bullying and harassment. Again, something really positive to focus on. The questions on people experiencing bullying, harassment, abuse are slowly coming down, but I think there's still more for us to do. And there's something interesting in the reasons that people are giving for bullying, harassment and abuse. And so I really want to do some work to further explore what we can do to address those responses which talk about email tone and style. I think there's an important thing for us to focus on there in terms of next steps. On the change and engagement section, the recommend CQC as a good place to work, you will recall we've used that as a proxy indicator for our employee index score in our pulse survey so far, and this shows good positive responses at 67%. That's a steady increase over the last few surveys, although you'll remember that we had that massive spike in May's pulse survey last year, which was, I think, to do with all of the effort that we put into supporting people at the very beginning of the pandemic. I think we've got an opportunity to shift some of the neutral scores in response to the question about feeling positive about our strategic direction. So there's an opportunity, I think, to really focus on kind of how do we engage people in that sort of that narrative around our strategic direction. And the question on feeling informed about changes and transformation is up from the main survey by 21 percentage points at 63% positive. This overall score has shifted a little downwards since we pulsed in the autumn time, which, if you remember, we were in the depths of our strategy consultation in the organisation. And so I think this tells us that our transformation engagement continues to be a key priority for us. The D&I section, I think, again, is a strong platform on which we can build as we approach our first year of the anniversary of the launch of our D&I strategy. It's not even a year since we launched the document, so that's a really good response, I think, for us. The awareness levels on our D&I ambitions are really high at 84%. I couldn't have predicted that that was the score that we'd get and the response that we'd get. What I want to do is look in more detail when we get the demographic data so that we can understand where there may be groups who are feeling less positive, and whether that's in a particular group, in a particular part of the organisation, or at a particular level in the organisation. So I think more to understand about that once we get that more detailed data. Some of the responses on career progression, opportunities and visibility of diverse teams across the organisation are, if I'm honest, not where I and we would want them to be. And they show us that I think that we really need to press on with our commitment in the D&I strategy and the RES and WDES action plans. These things do take time to move, but I think it's really important that as an organisation we remain focused on shifting the dial. I think the it's safe to challenge question is really interesting. So the 50% positive score that we see in this pulse survey is a slight increase on the last main survey and the last time we asked this question. But it's really important to note in this particular question that it's now at its highest that it's been in the surveys historically, and also that the rate of increase has been greater in recent years. So when I look back at the annual survey data from 2018, the positive score for this particular question was 42%. So what we know from our trend data is that we've all historically been consistently negative responses in this question that we've found it really hard to shift. I also think this question is really interesting when you look at it against the wholly positive scores on questions about being treated fairly and with respect. So there's something I think we just need to unpack and explore a little further in that question. So I will kind of just remind us what I think are probably the focus priorities, or I perceive to be the focus priorities from this organisational level data. And they are really to continue with our focus and attention on our D&I strategy and the WDES and RES action plans that we shared with the board in February. I really wanted to do something to really continue to focus on creating an environment where all colleagues feel safe to challenge. So there's something I need to sort of unpack a bit more around that. The role of leaders continues to be important in how we lead inclusively through change. we need to maintain our focus on our narrative aligned to transformation and actually the changes that we are starting to sort of develop. And I think also sort of linked back to the D&I sort of approach and priorities, I think there's a real opportunity for us to create more opportunities for diverse talent to flourish in the organisation. So I will pause there for comments and reflections.
So Robert, you started off. Thanks, Jill, by the way. Robert.
Well, thank you very much, Peter, and thank you, Jill, for that comprehensive report. And if I may say so, I think it's a testament to the commitment we have to change things for the better, that we deal with this in the public board meeting and the figure with the pretty granular figures that we have here. Clearly, there's a lot to be encouraged about. My comments would be, though, on the group of figures around harassment and discrimination. And the numbers, as I think you imply, are still of concern. And actually, it's one of those areas where percentages really don't tell the story, because actually, I believe always believe in this sort of issue, it's the numbers of people involved who are important. And for every person who has been or feels they've been bullied or discriminated against, or have witnessed that, a number of others will change their behaviour because that's what they've experienced. And so it is a creeping form of cancer that it's important that we don't tolerate. And it's an area where, in a sense, the temptation to benchmark and think, oh, well, we're about the same as other organisations, I think can produce, and I appreciate you're not doing that here, can produce a slight sense of complacency. But a particular concern, and I would have thought as a board, we need to ask the direct question, which is that where of those, if I read this correctly, those who reported an adverse experience of bullying or humiliating behaviour in the last 12 months, 38% are saying it happened to a senior manager or an executive director. And I'm not sure what that translates into in numbers, and perhaps we don't know or need to know. But I just wonder with what reflections, as it were, the senior management team or executive team can have about that, because all organisations end up looking like their leadership. So it's a hard question to ask, I know, but is there an answer?
So Jill, I don't know if you want to come in. Ian might want.
Yeah, I can come in. So I think you're right, Robert. It's the individuals and their experiences of work, and whether that is a sort of true to the ACAS definition of bullying, harassment and discrimination, or whether that is a perception of something that feels not appropriate for them. I think we need to take this seriously, and we do. I think you're right. The sort of recognising that you are about the same or better than another organisation is not the approach that we are taking in CQC. You know, I'd like to get to a point where these scores are zero, and I think we'll continue our commitment until they are. I think you're spot on about kind of the leadership and role modelling behaviours, and I think we're paying a lot of attention through some interventions that we're doing with our leadership cadre. We've got a big piece of work going on with reverse mentoring, which is actually helping people to absolutely understand the experiences of others who are not where they don't have the same lived experience. We're also doing a piece of work around inclusive leadership, which is across the whole of SLT 30. It's a very powerful piece of work, which we're helping people to understand where behaviours make an impact. This is not an easy, quick fix at all, but it remains a real priority for us. So I hope you feel assured about that.
Yes, I do. I appreciate how difficult this area is, but it is an area where the important point is how people perceive behaviour, and that's what has to be learnt from. And we all do. It's not. We all think we're great, and we all think we're being generous, but that's sometimes, unfortunately, not how we're received.
Yeah. Sadly, yes. Ian.
Yeah, Peter, thank you. I mean, I think just to echo Jill's point, we're not deliberately making any attempt to benchmark here. I think there's an easy temptation to try and see this survey in the context of similar questions that are asked of, say, NHS trusts, but we are a completely different organisation. So I think we're not making any attempt to benchmark. I think we have to hold ourselves to account on the absolutes. In terms of your broader point, Robert, though, I think one of the things that is quite striking is the impact of email tone and style. And the excessive criticism elements of perceptions around bullying and harassment. And I know we have had to be quite directive during parts of the last year. We've had to stop people from doing things that they would otherwise have liked to do. We've had to ask people to do things that they may not necessarily have wanted to do, and at times we've had to do that relatively quickly and in a quite a directive way, just because of government guidelines or because of an overarching need organisationally to keep people safe. And sometimes people disagree with that, and I know I've seen many examples of that on my weekly calls where people disagree with a policy position that we've taken, but we've had to be very, very clear that this is not a discussion point, and we've had to do something. So I think that's an element of it, but I think, as Jill said, the real power of these surveys is probably not in these aggregate numbers. It is about breaking it down by types of by people's backgrounds, the characteristics, which part of the organisation they sit in, and so on. So I think all of that needs to be the answer to this, and then we need to sort of, I think, also break this down into, so what can we tangibly do about this? And so one of the early conversations we've had is just looking at how we, what is the email culture around here? How do we write to each other? Are there some very practical things we can do just so that we can deliver difficult messages, but in a way that people see as constructive, as opposed to something which is seen as potentially bullying or harassing. So it feels like an important area, and I think, as Jill said, for me, it feels like there's a disconnect between this group of questions and some of the questions around perceptions of fairness, some of the questions around recommendation of CQC as a place to work, and so forth. And I think just trying to connect the dots between those two things is going to be really important for us. Thanks, Peter.
Thank you, Ian. Mark Saxton.
Thank you, Chairman, and thank you, Jill, for a very good report. I agree with Robert and Ian. I think those areas and those questions are very important for us, and I think it's good that we have this debate in the public board. Could I just make a couple of observations and then ask a question? And the observations around your areas of emerging priorities at the organisational level. I support all of those areas, but perhaps we could build into that, certainly based on what we've just been discussing, a continued focus on behaviour at work to keep combating bullying and harassment, discrimination and disrespect. I think if we could build that into our emerging priorities, that would be of value. And I also think, in terms of the D&I section and questions 8 and 9 that refer to equal opportunities and building of diverse teams that both scored below 50%, I think it's really important that in our emerging teams that we continue to demonstrate the visibility of our D&I actions, specifically around recruitment, around training, and around development. So those are two observations I'd make. A question I'd like to ask is that the pulse surveys and our responses to them, have really been a positive, the launching of the pulse surveys. So I'm wondering, are there any lessons that from the pulse surveys that can help us with the long survey, which you're still intending to run at the end of the year, i.e. how are questions asked, the flow of the survey, the way the surveys are promoted and advertised, and indeed the speed of the survey feedback, whether there are lessons that we could take from the pulse survey and apply them to the long survey to make it perhaps a more dynamic tool? That's my question. Thank you.
Jill, do you?
Yeah, I can respond to that. So I think you've identified things that that Mark are actually important, and I guess they're kind of being more explicit about our continued focus on behaviours at work is part and parcel of our D&I strategy and our action plan, but it's absolutely appropriate that we ensure that everyone is aware that this is a continued priority for us as an organisation. I think it's a really good call, an observation about are we playing back some of the actions and improvements. So we know from data from our recruitment activity that we're recruiting probably about 20% of our recruitment activity is to those from a Black, Asian or minority ethnic background. We probably don't make as much of a thing about that in the organisation, so there's probably more to do to sort of to really sort of recognise the movement that we're seeing in this important field, and still that we've got some way to go. I think in response to your question about the pulse survey and how we might learn some lessons for our main survey in the autumn, we're in the position where we're coming to the end of our contractual arrangements with our current survey provider, and that includes pulse survey in the summer, the main survey in the autumn, and then a further pulse survey early in the new year, until we move on to a new provider. I think it's important for our trend data that we try to keep as many of the questions right and relevant with this particular provider so that we can track our progress. What I'm wanting to do is really look at those dynamic factors that we've learned from, both in terms of timing for the pulse surveys and how we corral a set of questions that give us the right snapshot as we progress into pulse surveys for the future. So I think there's a lot of learning for how we continue to manage and develop our pulse survey approach. In terms of our main survey, I think there are some really important questions that, whilst we've asked them periodically over the last 18 months, we haven't asked them all in one go, and we've had quite an extraordinary period between the last survey at the end of 2019 and where we are now. So I want to try and keep that survey question set stable for this last iteration before we move into something where we can kind of look again with a fresh eye at some of the questions.
Good. Thank you, Jill.
Sorry, I didn't mean to cut across you, Mark. Stephen, let's move on to you.
Thank you, Peter. And Jill, thank you for a great report. And as you say, lots and lots of positives in there about things that are either already at a good level or making progress. So congratulations, lots to be very positive about. Two questions, if I could. One is the question about strategic direction, and I'd be interested in your take on what it's really telling us that 56% are positive about strategic direction and 44 by implication not. That could be I'm not positive because I don't understand it, which would sort of trigger one response. It's a sort of briefing and information response. Or I do understand it, but I don't like it, which would kind of require a different type of response. I know you've been putting massive amounts of effort into sort of briefing colleagues on what is the strategy, what is the direction, where are we going, what's the new operating model. So I'm absolutely clear it's not for lack of trying. What do you think, what more might it be possible to do to shift that indicator about being positive on the strategic direction? Second one, if I could very briefly, do you have any plans to ask staff about sort of the easing of lockdown and what it means for returning to or moving on to sort of returning to the office, returning to office-based working, returning to sort of ways of working pre-lockdown? For many organisations, there's quite a significant issue, I think, about rebuilding confidence about coming back into the office if you've got used to working from home. Is that an issue for you in terms of sort of staff surveying and opinion? Thank you.
A lot of questions, good ones. Jill, I wonder whether it might be sensible to ask Ian to come in and talk about the strategy, because I think there are other reasons than the two you suggested, Stephen, that might be behind what we're seeing. Ian.
Thanks, Peter. Yeah, Stephen, I think it's a good point, and certainly one of the things we've been picking up into anecdotally as we do an ongoing assessment of our communications, and we look for feedback specifically around specific pieces of communications. What's obvious is we did a big piece of work early part of this calendar year around talking about the next stages of our transformation activity. We talked about the new target operating model. We talked about our long-term ambitions for the next couple of years. So we set our stall out very clearly, and what people immediately and completely understandably said was, so what does it mean for me personally? What does it mean for my team? And they were questions that we deliberately weren't able to answer, because we started from the premise of we want to go out early and talk about the direction of travel, and then try and build a new organisation alongside people so we can be completely open and transparent about that. We recognised that there was a risk to that strategic communications decision, which was people would immediately be looking for detail, and that's exactly what's happened. So to some extent, this is not entirely unexpected. And I think as we get into the detail over the next couple of quarters, I think what we'll start to see is people starting to see that detail, understand where they fit in specifically in terms of their team, where they fit in specifically as an individual, and then I think that will drive confidence. So on the one hand, it's always nice to have seen better numbers here, but on the other hand, I think I can, based on other research that we've got, I think I'm confident as to why that is. I don't know whether Chris wants to just jump in and add to anything I've just said.
Just one thing to add to that. So just firstly on the stats in the pulse check survey, 50% positives, but actually there's quite a lot of neutral. So the rest of it isn't negative; it's neutral, and it's neutral for exactly the reason that Ian said, that people are looking for the detail. We actually had, and obviously I don't want to sort of preempt another conversation we're going to have later. We actually had more responses to this consultation from staff than we've ever had on any consultation, and there was absolute, in terms of the broad support, there was absolute support for the strategic direction. The challenge is about their place in that, and how we have the appropriate support for people to take on a slightly different role as the organisation changes as a result of the strategy. But just to be really clear, Stephen, this is not a half and half. This is a very broad either support or looking for more detail in order to understand where they fit in. I think those are the two challenges. And as Ian says, as we get into the conversations going forward, we'll be in a much better place for people to see how their skills and experience will be used in the organisation moving forward.
And Chris, it's not specifically on the agenda because we're still doing the analysis, but it is probably worth just also making the comment that externally the support for the strategy is overwhelmingly positive from what we've seen so far.
Indeed, from a variety of public groups, provider organisations, other stakeholders, there is uniform support for the direction that the organisation is taking, and from other organisations a desire to be involved in how we develop the detail of that as well. So really, it's a really positive conversation. We should talk more about this at the end of May as we launch the report.
Yeah, indeed, when we've done the analysis as well. So yeah, absolutely come back to that. Good, thank you.
Peter, did you want me to come back on Stephen's second question about kind of the sentiment for people and the worries that people may have about returning to offices? So yes, absolutely, we are planning to do a survey. We will also do some analysis of the free text comments from this pulse survey to see if there are any themes that are emerging about that. But our intention is to do some work to understand sort of how people are feeling, and we're not sort of pushing at all for people to return to offices sort of immediately. So we're handling this. We have plans in place which we're taking to the executive team shortly, and we'll be handling this with absolute sensitivity.
So I think, Jill, it's worth adding that the bigger issue for us is not people returning to offices, but people crossing thresholds. And I say it's a bigger issue simply because there are more people who do that than routinely come to offices. So it is a big issue, and I know some people are itching to get back, and other people are quite nervous about it.
Yeah, so it's the kind of, it will be testing all of that, and you're absolutely right. 81% of our workforce are now home based, so it's the sentiment of everybody leaving their homes rather than just returning to offices. But but for those who are returning to offices, there is probably an additional issue around use of public transport if that is a factor in them getting to their workplace.
Yeah, absolutely. Good. Thank you, Jill. And thanks, Stephen, again. Sally.
Thank you, Peter, and thanks, Jill. I agree with a lot of what's been said, particularly around the positive trends. So I appreciate you doing this in public, and well done to you and your team. Just had 3 comments actually, which are different. The first one is around the difference between our results on discrimination and our results on bullying and harassment. So there's actually an overwhelming percentage of people who say they haven't experienced discrimination. And if they have, it's from a range of people, and there's a specific point about disability perhaps we ought to look into. So I think the discrimination is quite different to some of the comments that people have already made around bullying and harassment, which inevitably crosses over with performance management. It's always quite difficult, isn't it? Particularly with the really difficult year that we've had. What we think is performance, people might be perceiving as bullying, or there might be genuine cases. So I just wanted to highlight the positive things around discrimination, even though we might have more work to do on bullying and harassment. I think the second thing is that on page 36 of our board pack, there's a bar chart around what people think would be most effective in improving how we are as an inclusive organisation. And I just think it's interesting that some of the very practical things we've talked about already on this call around reverse mentoring, around a new organisation structure, around policies, and possibly provision of support are right down the bottom, and all of the things at the top are actually emotional or cultural things around listening and acting, around leadership behaviours, around manager training. We've talked about that, and perhaps there's a mismatch at the moment between the practical and the cultural or emotional, because staff clearly don't feel that the very practical and the new organisation structure and operating model we have aren't going to solve their issues. And the third thing I was just going to say, I'm now responsible in this role as ACGC chair for liaising with the national guardians around freedom to speak up, and they're going to talk next in their item. But I just wondered whether staff feel that they always know the right place to go if they have a particular issue. And I think some of the other points we've seen in different items are around some confusion occasionally about where issues are dealt with in the organisation. So I'd be interested in the Guardians talking about that in their next item, but also us having a clear view as to whether we think people know the right place to go. Thanks.
Thanks, Sally. I think it's helpful for you to point out the distinction between discrimination and bullying and harassment. I think this sort of, I think there's often, as you say, an interface between performance management and where somebody is sort of having a conversation which perhaps isn't always as welcomed as it might be around improving capability in their role. I think there's. I think on that sort of bar chart of the sort of the reasons of the ideas or things that we should focus on, there are some, as you say, interesting things around cultural, behavioural aspects that we continue to need to pay attention to. I think the really important thing for me as well is right at the top, which is about recruitment policies and processes. So, you know, there continues to be a perception of unfairness. We're doing a huge amount of work on that. So I think there's that. There's then how our leaders and managers behave in an organisation, which I think we've kind of touched on in relation to some of the stuff around email tone and potentially some etiquette around how people behave and interface in what has been largely a digital environment for most people for the vast majority of the last 13 months. And I think I think your point about freedom to speak up and do people understand where to go? My team have been working really closely with the Freedom to Speak Up Guardians, because quite often some of their work is about signposting, and that's often because individuals may not feel comfortable or confident speaking to their line manager, so a point we need to address going forward. But I think sometimes just having another pair of ears to hear and listen to a particular concern is important for people. So I think it's a work in progress. I think our new HR policies have been launched as they've been refreshed give us a sense of a clear signposting, but I'd never say that our work is done in this area. And I think the way in which my team work really closely with the 3 guardians and have done over the last 12 months helps us to be able to sort of say, okay, this is something which should be dealt with within Speak Up, or there is a thought that actually this probably needs to be aligned to some of our HR policies and processes for the future. So I hope that gives you a sense of where we are now and where we need to continue to build.
Thanks, Jill. Mark Chambers, I think you're next.
Thank you very much. Jill, I very much welcome this paper, and it is more evidence and assurance to us that we're part of an organisation that's actively listening and that is committed to taking action that improves the position for everyone and makes it a truly inclusive organisation. I'm also pleased to see the commitment to getting underneath the data and really understanding what we're seeing. And I do think you talked about the free text responses. I think free text responses are enormously helpful, and they're easily overlooked here. But actually, there's some real gems always in there. I think the emergent priorities list is interesting. It's right on and very appropriate there that creating an environment where all colleagues feel safe to challenge is on the list, and to the earlier discussion that everyone feels comfortable speaking up, but also knows the right place to go to raise their issues. I do think that something else needs to be on that list, though, because to resolve some of these, speaking up is only part of it. The organisation's got to listen up and resolve the issues, and most of these issues are really quite difficult. Excessive criticism doesn't mean that we have an environment where people never get feedback, never get difficult developmental feedback. Tone and style of communication doesn't mean that you're not candid and straightforward and occasionally directive with people. It is about how it's done, and those will all, resolving it is all going to require really quite difficult conversations, because they're fundamental to people's behaviours, they're fundamental to people's style and way of working. And so I think we do need to aspire to be an organisation where difficult conversations are easy. Difficult conversations are the norm, and we're supporting people at both ends of that, the manager end and those raising their concerns, to make sure that those difficult conversations can be had in a consistent and easy way across the organisation.
Thanks, Mark.
Thanks. I think just on that last point around difficult conversations, I'd kind of like to change the focus to having constructive conversations, because I think ultimately people shy away from, even those who are most experienced line leaders shy away from something that's perceived to be difficult, or can do on occasions, for fear of not wanting to offend and upset people. And actually I'd I really rather shift the focus into constructive conversations where actually both parties in a dialogue come with a sort of an endeavour to sort of create a constructive outcome, rather than come at it because it's difficult. So, and that requires a sort of a shift of culture and a shift of behaviours, but that would be my sort of my ambition in terms of that space.
I agree with that, and a conversation that does not duck the issue.
Yeah.
It's unfortunately just avoiding the issue really doesn't bring resolution for anyone.
So, Jill, thank you very much for the survey and for coming today. I mean, I take two massive positives out of the survey and the discussion that we've just had. The first is, as you said, inch by inch, the results are moving in the right direction, and that's always positive, obviously. But the other big positive is that none of us are resting on our laurels. We really want this to be as good a place to work as is possible. And that continued drive to address people's issues, I think is really, really good. So thank you and your team very much for the work that you're doing, and of course executive colleagues generally. So everybody, I think we've had a good discussion around that, and it does segue quite neatly into the Freedom to Speak Up report as was suggested. So Ian, are you introducing this, or are we going straight to Carolyn and colleagues?
I think if we go straight to Carolyn, then colleagues.
Right. So, welcome to you all. I don't know which of you wants to start, but Carolyn, is it you?
Yeah, so thank you, everybody. Thanks for asking us to come along again and talk to you about Speak Up. And, I think it's probably good for us to introduce ourselves, because there are some new board members that we've not met. So I'm Carolyn Jenkinson. My day job is one of the heads of inspection. I'm currently working on the provider collaboration reviews and the DNA CPR thematic. And then I've got a couple of colleagues with me. Julie, are you there, Julie?
Hi, yes, I'm here. Hi, I'm Julie Lindsay Ayres. I'm an inspection manager in adult social care.
And then Uma.
Hi, I'm Uma Datta. I'm head of adult social care provider analytics in CQC.
Yeah. So we are the three Speak Up Guardians, and we've been in post a year now. Obviously a challenging year that everybody has had. So as you can see from our paper, which I'll take, that you've read that, we continue to hear from our staff across the organisation with varying issues come to us through the Speak Up route, and we have really taken that year to get a grip of what's happening and to assess how we feel that the culture is in our organisation. And I think we've got a much clearer understanding now of where we're at and where we need to go. And we are quite clear actually about the things that we need to do. And there's a lot more that we can do. But I think it's important to try and get over a couple of points today. So I think it's fair to say that as the Guardians, and we're not on our own, we've got a mass of around 100 Speak Up ambassadors as well. But, we do feel that we work in an organisation that ultimately does want to listen to what people have got to say and does want to hear from people that want to speak up. And the organisation cares about what people have to say. Sometimes what we find is our biggest challenge is it's that next bit, it's that so what question. And how do we get that assurance that actually we have listened and we've listened well, and that we've made a difference to people's experiences, and that's our challenge really. I think our paper, as you will hopefully feel, it resonates with the latest Pulse survey, and hearing the discussions that you've had of that on that. But it's also important for us to get across to you today that, in an organisation like ours as an arm's length body, it could be easy to say, well, we're not we're not providing direct services, so everything that comes to us isn't related to patient safety, which of course is what the Speak Up was, first started up around, with Sir Robert there, obviously listening in. But anything that our staff do in our organisation can have an indirect link to patient safety, because if our staff are feeling, not in the right place around how they do their job, then it can impact ultimately on patient safety. So it's important that people really do feel able to speak up about anything, and they can come to us about anything. And as Jill said, one of our biggest roles is that we have to signpost people, and we can often sort things out. We can often be another ear and make some suggestions and quickly try and nip things in the bud, for want of a better phrase. But then we also find that we have another stream of cases where they're more complex, and they're often quite historical, and they go back over a number of months, or if not, that people have had issues for quite some time, and they often take a lot more unpicking and a lot more sorting out. So I think I'm probably going to pause so that we can have some discussion, because that's probably a better use of the time.
Excellent. Thank you, Carolyn, very much indeed. Mark Saxton, I think you were first.
Thank you, Chairman, and thank you, Carolyn, Julie and Uma, for a very, very good paper. Last month we had the presentation by Henrietta, who informed us of the traction of the Speak Up Guardian across the whole health sector. So to get your report directly afterwards and to follow our journey, I think has been instructive and helpful. I was particularly pleased to see, as you pointed out, the signposting role, working with the People Directorate. I was also very pleased to see the training investment around mental health advocacy, which is a tremendous development, I think, within your roles. I think it's important, however, that as we move forward, we really have a group of guardians that are reflecting our whole organisation and support. You talked about the survey, that the guardians working to support the issues highlighted in the survey. So bullying, disrespect, discrimination, abuse and well-being. And I suppose my question is, how are we going to collaborate to achieve this? I mean, we've already got examples of you working with the People Directorate and signposting, but it seems to me that collaboration and the support of you will only enhance the ability for people to feel confident and supported to speak up. Mm-hmm. Thank you.
We know we have been working really closely with HR and trying to make sure that we signpost people appropriately. And sometimes, there are issues that boundaries get a little bit blurred about what sits with us and what we need to pass over to HR. But I think ultimately, often our staff, they don't mind where things go, but because ultimately all they want is some sort of, improvement or resolution, or they want things to get better for their experience to be better. So I think we need to keep hold of that and perhaps remember as well that sometimes not one size fits all, and we have lot policies and procedures, and for very good reason. We have to have policies and procedures, obviously, but sometimes we might need to look at things a bit more flexibly in order to meet people's different needs, and make sure that we do work. Us as guardians, we need to have a close relationship with HR, but we also need to maintain our independence as well. And we really need to challenge, I think, timeliness and that feedback loop, that so what question. We really, really need to work on that so what question.
Yeah, I think you're absolutely right on that. All I could say is that you know, the listening element that you've so forcefully put forward, you know, that's a really important part of you know, managing people and helping people to you know, achieve their best in the organisation. Thank you.
Great. Ian, did you want to come in and on that point?
Yes, please.
Yeah,
yes, please. I mean, I just that and a sort of slightly more general point, I guess, which was, yeah, I think one of the comments was made earlier on was the sort of the potential for a plethora of different ways to essentially raise the same thing, and there's an upside and a downside to that, I think, which is, you know, I know with some of these cases, you could raise them directly with your line manager, you could raise them with your trades union, you could raise them with a senior manager, you could raise them through freedom to speak up. And in some respects, it doesn't matter. I suppose there are, you know, my preference would always be that you talk to your line manager and try and resolve the issue quickly, because that's always the quickest way of resolving it. But I think the thing that's really powerful about the Guardians is this connection with the people team, and the openness with which I know a number of senior managers view the freedom to speak up process. So as a consequence of that, I think it means that things can be raised and issues can be surfaced relatively quickly and then listened to. But as I say, you know, given the number of policy-based activities that we've changed over the last year, this is a relatively modest number of speak-up issues, given the fact we have had to be quite direct about changing some things. We've had to move at some pace. We haven't necessarily been able to talk to everyone about every change that we've made. But I think this represents a, you know, broadly positive story. But I just want to make the point that this sort of plethora of channels is potentially a good thing, because it means that people can choose the channel that perhaps most suits them. Thanks, Peter.
Thank you, Ian. Jill, did you want to add something on that point?
Yeah, I just think kind of into that sort of strengthening the collaboration now, sort of just thinking as Mark was talking and as Ian was talking, I think there's an opportunity perhaps to invite the and forgive me for saying this out loud without actually giving you the heads up, but it's just come to me that actually I think there's an opportunity perhaps to invite the Guardians to come and report to the People Committee that I chair on as a subcommittee of the executive team, just to sort of to start to pick up some of the thematic issues, not go into individual cases, but I think given we have the senior people leads from each across the organisation on that committee, it will be a helpful conversation for us to have periodically. So I'd like to invite an invitation for Carolyn, Julie and Uma to join us.
Great, thank you. Robert, you were wanting to come in, I think.
Thank you. Thank you to all of you for this report, but more importantly, perhaps, thank you for taking on this really important role. And I appreciate from the work I've done how difficult it can be. So firstly, a big thank you to all of you. Taking a little point from what Ian has just said about the number of cases, rather like complaints, one can never be sure, I think, whether a number is good or bad, whether if it's going up or down, it's good or bad. All I would suggest is that it's quite likely that the number of cases you have could be a tip of an iceberg. It might not be, but it could be. So I just put that caution there. I really welcome the idea of the ambassadors, and I think that I would hope that would lead to a more relaxed atmosphere in which general conversations can happen in various parts of the organisation, which in themselves can increase the likelihood that raising concerns becomes just normal business. But I have a question about it. You report that a small number of them will undertake or have undertaken mental health advocacy training. I'd just like a bit of an explanation about the reason for that, and I think I can see it, and how mental well-being in particular is an important aspect of this. The caution I would have is to ensure that it's not misunderstood. And I say that because of the particular history of one whistleblowing in the CQC, I think probably before all our times, when one particular high-profile whistleblower was treated as if they were a mental health case. And corporate memory being what it is, it's important that that is not misunderstood going forward. Basically, thank you very much for what you're doing, and I look forward to continual reports because there's a lot of learning to come out of it.
Thank you, Robert. Yes, I too remember the case that you're talking about, and you're right, it was before all of our times.
Do you want us to?
Yeah, please.
Julie, did you want to?
Yeah, I could respond to that. Yes, I mean the mental health. It's a mental health advocacy role, rather than advisor or anything other than that. And it's very clear within the training that it's about recognising someone, because usually when people are contacting us, they're in some state of turmoil, emotional turmoil, because they perceive they're being bullied, harassed, or they've got other issues going on that can be infecting them. So it was just about a group of ambassadors being able to have the skills to recognise if someone may potentially be actually suffering from some kind of mental health concern around that, and then within that being able to signpost to the correct area, certainly not diagnostic or being above the station. They absolutely know their remit and what to do within that role. I mean, what was quite positive was that actually we've had one person actually request somebody, an ambassador, with that particular training. So I saw that as a positive, that they were actually seeking out that particular support. So yeah, we absolutely know the remit and the responsibility that comes with saying that we've got mental health advocates. It's purely about signposting, Sir Robert.
Yeah, no, I absolutely understand that. It's that, as always with these things, the messaging needs to be carefully handled for the reason I mentioned.
Yeah.
Thanks, Robert. Thanks, Julie. Very good. So Ali, then Sally, then Mark, and then we'll move on. Ali.
Thank you. Thank you for the report. To echo my colleagues, I think there's a tremendous amount of information here that is positive and shows that the service has been well and progressing over the previous year. I was particularly pleased to see also at the end the continued acknowledgement of the evolution and the focus on outcomes that we've seen next year. What would be really interesting to see 1 year from now is actually more narrative to support the numbers as well. Not going into specific details, but as I think Jill and others mentioned earlier, to really help us understand how this is making an impact on individuals across the organisation in terms of stories. I do have one question for clarification, if that's okay. We noted in the report that more than 2/3 of concerns recorded were for female colleagues. Is this disproportionate to our staff base, or is this roughly in keeping with the gender balance of our staff?
Yeah, Jill, if you want to come in.
Our workforce, we've got a sort of 70% female workforce, so I'd expect that to be entirely proportionate. This data, of course, is not my HR data. This is the data that the ambassadors gather. So it's sort of, I guess I'll leave them to explain sort of the validity of their data keeping. But we've got, but we have, our workforce is 70% female. So yeah, you'd expect that kind of proportion.
Yeah. Thank you.
Okay, thank you. Sally.
Yeah, I only had the pleasure of meeting Caroline, Julie and Uma quite recently, but I just think it's worth pointing out that these roles have only been in place for a year. They're obviously incredibly committed. It's good that CQC is taking part in something which is much wider across health, and we're playing our part as an arm's length body. And I know that the three of them, with their ambassadors and their network, are trying really hard to improve what we do as we go along. So they talked about recording better data around the reasons for people's concern, around following up on actions and making sure that they are complete and there is a resolution, and also making sure that our revised policies reflect any concerns that come out. So as the person on the non-exec side of the board who's going to pick that up with them, I just wanted to echo what Robert said, to say thanks for the commitment. They all have quite senior day jobs alongside this, and I suppose it's just a point that says if we believe, if we do see an increase, if this becomes more widespread across the organisation, just a plea to say we might want to think about additional support or how we work this given that they're doing this as a top-up role alongside a senior management position in CQC. But well done, ladies.
Thank you.
Thank you.
So I echo the thanks and appreciation, Sally. And just for clarification, I'm sure you didn't mean to suggest otherwise, but we've had a speak up role in CQC for much more than a year. It's just that our current colleagues have been in post for a year. Probably seems much longer to them, but anyway. Right, Mark Chambers, and then we'll move on.
Yeah, just to echo from my perspective how enormously valuable the role of the Guardians is, and to echo the thanks that we've heard from other colleagues, and to see this as part of a broader commitment to a speak up culture within the organisation, where if something doesn't feel right, people put their hand up and take advantage of the multiple channels to raise their concerns. It is enormously valued by the board, and it ought to be enormously valued by the board. One of the things that you mentioned, Carolyn, was that this is a sort of a vital early warning and the opportunity to fix something while it's still fixable. And something that you might not have otherwise seen. And of course, it's an incredibly useful tool to reach throughout the organisation and find out what's really going on in the organisation. So what I would observe that from the business world, there is strong empirical evidence that actually more people speaking up is good news. Organisations that have more speak up reports generally have better outcomes in terms of regulatory interventions, levels of litigation within their business. There is empirical evidence to support this. So we should not be afraid of seeing more numbers. Obviously, we should need to understand the substance behind what is being raised, but more reports in their own regard is not bad news. I think it's in many ways it's to be encouraged.
Great, thank you, everybody. I'm just a little bit conscious of time, but can I just, Uma, Julie, Carolyn, thank you. First of all, for coming today, but much more substantially, thank you for all you do for CQC in both your roles, but particularly in this one. So really good, and we will obviously be seeing you at the board at some future time. So thank you.
Thank you, Peter. Thanks, everyone.
Thanks very much.
Great, good. So Sally, ACGC, your sort of summary of your meeting, please.
Yeah, so the board are just asked to note our report, no need for action. Our March meeting was very comprehensive, as you would imagine. It always includes external auditors, National Audit Office, internal auditors, our own exec, and our members of the board who are there to challenge and provide assurance. So I feel like Jill's really under the cosh at the moment. We had a presentation on people metrics, but at least we are consistent with the way that we are both asking questions as non-execs and challenging on behalf of our staff and the results, and trying to seek assurance to come back to the board. And you've heard many of the themes today about delivering very soundly on the people plan. We also talked about our internal audit programme to provide assurance, and despite the pandemic and all of the delays that there might have been, the internal audit programme has been delivered. There's only a little bit of field work left, which always hangs over into April, and some specific work around cybersecurity on our digital foundations projects that we were doing. So I just wanted to say thanks to the exec who've manfully delivered all of those reports in line with the auditors despite the pressures of the pandemic, and that's a really good result. We talked about risk, and you'll know that we are having ongoing conversations about risk between our committees to ensure we're handling those in the most effective way. And then on our external audit, National Audit Office, have been doing their interim audit. They take 9 months results just towards the end of the financial year. And then they come back after month 12, which is around about now, with their plan to certify our accounts. They talked, there are no issues there. They talked also about the timetable for next year, because people will have been aware there is a delay due to the auditing of local government pension schemes, and we are thinking about a possible way to try and bring that forward and make it a little earlier for next year. No particular issues to report, and our next meeting is in June, when we'll look at the annual report and accounts, which will be coming to the board in due course.
Thank you, Sally. I hope Jill doesn't feel under the cosh. I hope Jill feels really supported, because we're also interested in our people and Jill's role in that. So, as I say, I hope she feels loved, not under the cosh. Any questions for Sally? Comments? No, excellent. Thank you, Sally. Any other business does anybody want to raise? Okay, so that's the end of the meeting as such, but we've got a couple of questions from the public. 2 questions, in fact, from Robin Pike. The first is, how well did primary medical services perform over the 4 days of Easter? Robin, that's a question you need to direct to NHS England, not to us. I'm afraid you'll have to go to their board meeting rather than ours. Your second question was, how has CQC regulated the work of independent hospitals during the pandemic? Have the numbers of NHS patients being treated in independent hospitals changed during this period? Ted, I don't know whether you can answer that one for Robin.
Yes, thank you, Robin, for the question. This is really a good opportunity to pay tribute to the work that's gone on in independent hospitals supporting the NHS during the pandemic. We saw a lot of really important work going on, particularly in the first phase of the pandemic, where there was an increased referral of NHS patients to independent hospitals, and they played a very important part in keeping abreast of some of the, particularly the non-COVID work. And as we go into the recovery period from the pandemic, the capacity within independent acute hospitals is going to be important in recovering and making sure people with other conditions other than COVID get the treatment that has been delayed by the pandemic. So they've been a very important part of the system. In answer to the question about how we regulate them, the same standards apply to independent providers as to NHS providers, and our approach to regulation is broadly the same. During the pandemic, we've had a risk-based approach to independent providers, inspecting them where risks are identified and taking action where necessary. As I discussed earlier on in this meeting, we've used a transitional monitoring approach we've had a program of contacting all independent healthcare providers over the last few months to make sure that we have assurance about the standards they're providing. Where that's identified any risks, of course, we've taken action on them. So we've kept vigilant on independent healthcare during the pandemic, as we have on the NHS.
Thank you, Ted. And then the last question we had is from David Hogarth. And it is, has the Care Quality Commission received requests from any source, for example, DHSC, ADAS, local authorities or care services, to ensure that a majority of care services are rated good or outstanding? And David, I can absolutely say that I have never personally had any such request, nor am I aware of CQC as an organisation having that sort of request. And you will know we wouldn't respond anyway in that way. We don't operate a quota or anything like that. What I have quite often said when I'm asked, you know, what would success look like for CQC? It would be that all the services that we rate are outstanding or good, but achieved because there's been an increase in quality, so that we get to that result, not because we've altered in any way how we measure what is good. And so a lot of the discussion we have with all kinds of different organisations is what more can be done to improve the quality of care being provided by those organisations that are either requiring improvement or inadequate. But it's not a pressure point, and I wouldn't want anybody to think that either we've been put under pressure, or if we were, we would respond in that way. So I hope that answers your question, David. And I think that concludes the business for this morning. So thank you all very much indeed for your time and for your contributions.